Local programming on KRWG Public Media made possible in part by viewers like you. Thank you.
This is KRWG Public Media, TV, radio, online. News that matters. Now, across the Mesilla Valley and the borderland, the stories that shape our community. From the KRWG Broadcast Center at New Mexico State University, this is Newsmakers.
Thank you for joining us on this special edition of Newsmakers. I'm Madison Staten, in for Fred Martino. COVID-19 vaccination efforts are well underway in New Mexico, with over 1 million doses administered. Counties across New Mexico are reporting positivity rates under 5%, leading to reopenings all around the state. In this edition of Newsmakers, we'll dive into vaccine distribution and other issues related to the pandemic, starting with a look at one of Las Cruces' vaccination sites. I visited the New Mexico State University site to learn more about distribution. New Mexico Health Secretary Dr. Tracy Collins says the state intends to offer the vaccine to the general public by mid-2021. The state began its effort by targeting the most vulnerable populations.
We started in phase 1A with healthcare personnel frontline and also first responders, those taking care of patients, and we've now opened up the initial part of phase 1B, which are individuals 75 years of age or older. We will then move to individuals who are 16 or older with underlying medical conditions, followed by frontline essential workers and vulnerable populations.
In a recent press conference, Governor Michelle Lujan Grisham addressed how distribution is expected to increase with the opening of more community vaccination sites.
The community vaccination sites, which we're launching here, are very effective. It means that we can move many more people, which means that we can increase vaccine distribution. You should expect us to do more of that and to do more in partnership with our hospitals so that we're increasing the number of vaccines we can get into arms every day, and a really, quite frankly, very sophisticated process to push people out to appointments.
One such vaccination site is located on the New Mexico State University campus, where an average of more than 600 doses are distributed at each weekly event. NMSU COVID project manager John Webster says the university has had an ongoing relationship with the New Mexico Department of Health, organizing both COVID testing and vaccination efforts.
The coordination has been ongoing. Unfortunately, with the quick rollout of the vaccine, we typically get, for our first one, we had about 4 days to plan it. So it's huge coordination with the state, the county, the city, and NMSU volunteers to get them out there to the site to do what we need to do, because this is all volunteer based at over 75 volunteers for each vaccination pod.
Members of the NMSU community make up the majority of volunteers, which include nursing staff and students, as well as others from Aggie Health and Wellness. Webster encourages the general public to register for the vaccine on the New Mexico Department of Health's website. Once the Department of Health has reached out and the appointment is confirmed, he stresses the need to arrive on time.
Don't show up an hour early because all that does is create a bottleneck within the parking lot, because we're still going to stage you for your correct time and you will just sit there and wait. We will get to you if you have an event code, but that's what you should expect. If you arrive pretty close to your time, your expectation to get through would be anywhere from 30 to 45 minutes.
NMSU reports no vaccination doses have gone to waste, with any leftover doses immediately being transferred to a different vaccination site in need of additional resources. Webster says his main goal is to get the vaccine to as many people as possible.
It's tedious. This is something we've never done before. We are learning every day, every time we do it. It's an awful hard thing to plan for when we're in a pandemic. We want to make sure that we have enough doses, not only for the first rounds, but the essential dose, which is that second round. So that's the biggest takeaway that we're learning is, on top of that, everyone wants it. We get it. We know everyone wants the vaccine, and we want everyone to have it from our point of view.
Since KRWG's visit in January, the New Mexico Department of Health has expanded vaccination eligibility, now open to those in Groups 1C. And the Department of Health isn't the only one reducing restrictions. The Las Cruces Public School District has opened its doors for in-person learning, but some students are choosing to remain online. Reporter Sarah Rodriguez spoke to some of the district's teachers about the challenges of remote learning.
Las Cruces Public Schools has been continuing a remote learning model for classroom instruction. The new virtual classrooms were a learning experience for teachers. Centennial High School teacher Beth Rewalt describes how she has adjusted to her virtual classroom.
I feel like I've adjusted well. I feel very comfortable with Canvas, which is our online learning platform. I feel like I've learned and found ways to try to engage students in this unconventional style of teaching and learning.
According to Rewalt, the initial issue that teachers struggled with was online participation from students.
Initially, it was just getting kids on Zoom. So it was really hard to get the students to log into the Zoom sessions. There were no requirements for attendance, and there still aren't. But once I could get the word out that we're actually doing something that's engaging and maybe even fun, and you're actually learning something, I started to get, my attendance got a little bit better.
Remote learning reduces the opportunities for hands-on learning experiences. The challenge has been finding ways to supplement hands-on learning at home, says Rewalt.
I think academically, I'm a science teacher, so the interactivity of the things that we did in the classroom, that's been really difficult to not have. So hands-on engagement opportunities are super valuable in the learning process for most kids, especially in science. And so this has been missing for the most part.
Remote learning also poses additional challenges when it's your first year of teaching. Alyssa Flores describes what her main struggle was during her first semester as a teacher.
That was probably the thing I struggled with the most in the beginning, is trying to get them to come out of their shell, turn their cameras on, talk to me. And still it's an everyday struggle, but they've gotten better.
Flores has focused on establishing trust and support with her students.
It's hard to tell kids, like, advocate for yourself, reach out to me, email me, contact me. It's easier said than done, I guess. And so a big thing for me has been like communication. Some of these kids are going through the unthinkable, and so just trying to be that one thing that's going to be solid for them is really important.
After an entire semester of online instruction last fall, students like Mateo Garcia Bryce knew what to expect for the spring semester.
Last semester, it was relatively easy just because we were still getting used to it. We were still getting the hang of it. And this semester has pretty much been the same, except they've taken off, you could say they've taken off the guardrails, right? So it's a little bit more difficult, more rigorous.
Even though remote learning has its challenges, Rewalt describes some of the positive skills that remote learning can provide to students.
If a student is struggling with organizational skills, remote learning is probably good for them, because in Canvas, everything's very organized. You know when your due dates are, all your assignments are in one place. You don't have to worry about losing a paper or, forgetting to write down some data in class that you need to go home and crunch numbers for. So I feel like if you struggle with organization, you probably benefited from this remote learning.
Although this school year looks different for students, teachers are continuing to have a positive outlook on the situation, says Flores.
Really, it kind of gets better every day. I think the kids, it's hard for them, it's not ideal for them, but I know that they come and they're looking forward to seeing me, and I've been having really good attendance lately, and I just try to keep the energy really high and try to be really positive for them.
Students and teachers will continue to adjust to this new style of education. For KRWG Public Media, I'm Sarah Rodriguez.
Qualifying for a COVID-19 vaccine is a challenge for many Las Cruces residents. Reaching seniors with limited mobility, transportation, and technology remains a concern for government officials. I talked with one senior who highlighted some of the struggles. Las Cruces Assistant City Manager Eric Enriquez outlined some of the challenges of reaching the senior population for COVID vaccination.
The top challenge is the technology. There's a lot of seniors out there that don't have access to computers or registering for the vaccination. So the city is creating a vaccine task force. And this task force will be comprised of a lot of leaders in the community to get resources out there, such as funding, education, communication, using as much of the leadership in the community to help those that are vulnerable and have challenges with getting the vaccination. So the seniors, the elderly, that's one of the priorities.
For Lynette Tompton, a senior in Las Cruces, the matter is personal. In Group 1B, she is patiently waiting for the opportunity to schedule a vaccination appointment. She stresses that getting vaccinated is a matter of life or death for the people in her age group.
If they don't get vaccinated, they're probably going to die because they're older, and most seniors, even if they've been healthy their whole life, by the time you're in your 60s, normally you start to have some underlying conditions that you didn't have when you were younger. We can't just put these old people out on a piece of ice like they used to in the olden days. And I realize that there's a lot of younger people that don't value seniors, and they don't care if we die. But we care if we die. You know, we do care.
But Thompson is without a car, leaving her unable to access drive-through vaccination sites on her own, like the one on the New Mexico State University campus. To get around Las Cruces, she often uses the city's dial-a-ride service, something that has to be scheduled weeks in advance.
But the problem with them is that you have to schedule 3 weeks in advance. So let's just give an example. If I'm a senior, I get my appointment time, I've got 3 days to get there, I can't take the dial-a-ride.
And that's just the beginning of the challenges facing seniors who are seeking to get vaccinated at walk-in sites.
I can't stand up very long to wait in the line. Most seniors really can't. I mean, they can stay up maybe 5-10 minutes, but I'm hearing horror stories about seniors who are falling down and hurting themselves in these lines.
The city is working to address the concerns, offering wheelchairs for those that visit the Las Cruces Convention Center vaccination site. Seniors can request a wheelchair from any volunteer, such as those working in the parking lot, when they arrive at the convention center. For seniors with no ability to get to a vaccination site or limited access to the internet, Enriquez says the city's COVID-19 vaccination task force is working to reach seniors through its Meals on Wheels program.
We can make sure that we're getting these individuals vaccinated and reaching out to them either by phone or however they're listed on the Meals on Wheels, even to stop by, because they're actually making physical contact with them by dropping food off at their physical address and then scheduling them for some homebounds.
The city is also working to create a hotline for residents in need of additional help related to the pandemic. For now, anyone with concerns can call the New Mexico Department of Health COVID-19 hotline at 1-855-600-3453. Expanding the number of vaccination sites is also being explored, with a focus on educational institutions and senior centers. Enriquez says the city's COVID-19 vaccination task force will be instrumental in getting the pandemic under control.
I think it's going to be very instrumental for getting people in the community vaccinated. We're going to do our best. We're going to charge this hard and make it happen. This is a break we've been waiting for this pandemic, and we want to get back together and living normal lives again. And so this is one task force that I think is going to be very instrumental in getting that accomplished.
Lynette now qualifies for the city's homebound vaccination program, targeting residents with mobility issues. KRWG rode along with the Las Cruces firefighters distributing the vaccine to see how the program is working to reach the city's most vulnerable residents.
He said these 3 for sure, and then 2 from that list.
Las Cruces firefighters Ariel Caro and Matthew Castrahan aren't only distributing the COVID-19 vaccine, they're bringing hope to many of the city's most vulnerable residents.
That covers us from coast to coast.
Awesome. Congratulations.
The pair is part of a team assigned to the city's homebound vaccination program, targeting those who are not physically able to travel to a vaccination site. Firefighter Ariel Caro says she's thankful for the opportunity to serve.
They love that we're helping out, going to their house and making their life and their loved ones' life like a little easier for them. I'm glad that the fire department is a part of this program and the ones that are like sponsoring the program, just so that way people can see that we're here for them.
City Interim Deputy Chief Justin Allen says the program is hoping to distribute 90 vaccines a week. They're currently targeting a specific group identified through city programs, Las Cruces residents who are homebound due to illness, injury, or other circumstances.
We're utilizing our senior programs and quality of life department within the city of Las Cruces. We're utilizing them and using a list that they have for their Meals on Wheels and several other homebound initiatives that they have and programs. Currently, we're at least 650 plus homebound individuals that we've identified.
Many of those identified through city programs did not register for the COVID-19 vaccine themselves, relying on registration events or friends and family members. Caro outlined how firefighters can pull up a confirmation code on site to document that the vaccine was distributed correctly.
Some people don't have access to cell phones. They don't have access to a computer. All they have is just a flip phone. So I go ahead and put them into the system on the Department of Health website and just register them so I can give them a confirmation number and just so that it's documented they got their vaccine.
Las Cruces City Councilor Tessa Beta-Stuvey chairs both the city's COVID-19 vaccination task force and the Health Policy Review Committee. She highlighted how the use of the Johnson & Johnson vaccine is vital for the homebound vaccination program because it requires only one dose.
When we do have individuals that are in high-risk populations, sometimes it can be harder to see them again for that second time. And there is a timing issue with our Pfizer and Moderna. You need to get that second shot within a time frame. And so just having the Johnson & Johnson makes that process much more smoother and allows us at the city to be able to reach more people as well for that full vaccination.
Beta-Stuvey emphasized that a lack of resources should not prohibit members of the community from being vaccinated.
There are many people, they just don't have that access to be able to go out and get the vaccine. Even mobility is such an issue for a lot of these individuals. And so by us reaching out to them, we're able to care for them as well in these different capacities and make sure that they stay safe and healthy.
For City Interim Deputy Chief Justin Allen, it's about serving those who might not otherwise have an opportunity for vaccination.
Everybody, I think, realizes the safety measures that needed to be taken with the COVID-19. So it's important for us to be able to go out and reach them and show that they're still going to be able to receive the same amount of treatment that everybody else is.
COVID restrictions are beginning to lift in Doña Ana County, giving businesses more flexibility. Reporter Sarah Rodriguez spoke with some local business owners about the reopening and the challenges that remain.
Local businesses have struggled over the past year to adjust to different COVID-19 restrictions in the state of New Mexico. The restaurant industry has taken some of the hardest hits with various opening guidelines. La Posta owner Tom Hutchinson describes the challenges that his restaurant has faced.
We've seen my industry impacted in ways that perhaps other industries haven't been in terms of different levels of being open. Sales have been tremendously impacted, but more importantly, it's been a tremendous hardship on my staff. We started COVID with both restaurants. My employment was about 175 folks. We're down to maybe 100 now.
Current New Mexico guidelines divide counties into 4 color tiers consisting of red, yellow, green, and turquoise. Each color level provides significant differences in capacity restrictions for restaurants. Restaurants and businesses are given minimal notice to adjust when their county shifts tiers, says Hutchinson.
We're given zero notice. We find out when the public finds out. You don't flip restaurants on with a switch on and off. It takes us a while to ramp up in terms of employment and inventory.
Local business and restaurant owner Marcy Dickerson also believes that the restaurant industry needs more notice to make these adjustments.
I believe that we deserve, more heads up. We deserve more time in switching because, especially in the restaurant industry, we have to order food, we have to order alcohol, we have to schedule staff. The 2-week yo-yo schedule really does cause a huge amount of hardship for restaurants and people in the hospitality industry.
With uncertainties over what color the county will shift to next, Dickerson states that restaurants always have to expect the unexpected.
The hardest part about the whole thing is not being able to know what's coming in the future, not being able to plan for the future, because you really are at the whims of, people's interpretation of the numbers. So there's just a lot of people's livelihoods hanging in the balance of these numbers and the decisions being made by the governor.
The entertainment industry has also been hit hard by state COVID restrictions. Movie theaters and other large entertainment venues have remained closed for the past year. Allen Theaters Company President Russell Allen describes how this has affected Allen Theaters establishments across the state.
Well, we've been closed for 50 weeks, actually 50 and a half weeks. And for lack of a better word, it's been absolutely devastating and unreal. And we've been We've been open every day for 112 years, and now all of a sudden we're shut down for, it's going to be a year plus, several months, I suspect, before it's all done.
Allen believes that Allen Theaters is equipped and prepared for a safe opening across New Mexico.
We have full control over when the showtimes start and when they finish, so we know exactly when you're going to show up and when you're going to leave. We have material or equipment that we can completely sanitize every single surface in every single auditorium after every single showing. We've purposely kept our crowds down so that we don't have to worry about lines. And those, of course, those things will automatically just translate right over to COVID policies.
Allen Theaters will be allowed to reopen when counties hit the turquoise tier. Allen believes that this will not happen anytime soon for Doña Ana County.
We won't open our theaters until there's turquoise, giving us a fallback to green. Doña Ana County and Bernalillo County, for that matter, up in Albuquerque, because of our population, will never hit green. It's not a possibility. So we should be able to get some other theaters opened around the state, but in Las Cruces, under the current guidelines of 8 cases per 100,000, we'll never see green.
Business owners are hopeful that there will be more flexibility with the COVID restrictions, says Hutchinson.
I was just hopeful that the governor could make some adjustments to give us, to create some more certainty. You know, sliding backwards is not a fun thing to do. And perhaps if they had given us a longer period to make that adjustment to maintain that 5% positivity rate, would have deflected all the disruption and chaos associated with closing a business down, or at least changing the capacity levels.
New Mexico counties will continue to be evaluated on a bi-weekly basis to determine their tier color status. For KRWG Public Media, I'm Sarah Rodriguez.
In January, Doña Ana County introduced a mandatory COVID-19 vaccination policy for some employees. The county says it's a critical safety measure, but some critics argue the directive infringes on the rights of employees. I recently interviewed Doña Ana's county manager to learn more about the policy. Approximately 390 essential Doña Ana County employees have been directed to receive the COVID-19 vaccine by the county. The mandate affects public safety personnel, including law enforcement officers and full-time paid firefighters. County Manager Fernando Macias says the directive was issued because the rate of vaccination wasn't increasing quickly enough.
My directive was really more towards approximately 200 to 220 of our employees who had not been vaccinated at this point, to really move them to take advantage of the fact that they measure so high in the priority list for vaccination. And why are they there? They're there because they have the greatest impact in the community.
Miriam Aranjani, an associate professor of law at the University of New Mexico, says government officials can mandate vaccination.
The law is pretty clear that using the state's police power to regulate for the health, safety, and welfare of its citizens, an employer can require vaccinations.
Aranjani pointed to Jacobson v. Massachusetts, a 1905 Supreme Court case that ruled mandatory vaccinations constitutional. But she says just because she believes employers can require vaccinations doesn't mean it's the best solution.
There are some strong arguments for why it's probably not the best approach. One is there are going to be people who don't want to, or say that they can't for religious or medical reasons comply with such a requirement.
By mid-February, 93% of county employees had been vaccinated. Of the 390 personnel required to get the COVID-19 vaccine, 9 requests were filed for special accommodation due to religious or medical needs, and 7 were granted.
When it comes to the security of the community, I believe that we have enhanced authority to make sure that we are uniformly providing that service. Put your own individual beliefs aside, because your role is to protect the public. That's what you were hired for.
But critics, like New Mexico attorney Anna Gardner, say that because the vaccine has been given emergency use authorization by the FDA instead of full approval, the legality of the county policy is in question.
They're authorized for marketing and distribution only under the emergency use authorization of the FDA. People don't necessarily understand the difference between, well, the FDA said that they could market it versus approval. People don't really understand that fine distinction. It is experimental. That's the basic bottom line. And because it's experimental, everyone has the absolute right as a human being to refuse it, and without consequences of losing their jobs.
It's a sentiment shared by Paul Castaneda, a regional union representative for county deputies.
We don't believe it should have been mandated. Worst case, I think we should have had some conversation before that type of notice went out to all employees, quite honestly. I mean, not just, from a CWA standpoint, but other unions as well. We were not reached out or even talked to or even told this was coming out until it was actually put out by the county manager.
University of New Mexico Associate Law Professor Miriam Aranjani underscored the importance of public buy-in surrounding vaccination, stressing that individuals should seek out educational resources about public health measures.
So many laws and policies really require that people buy into whatever it is that's being mandated. And so I always think it's important for the public to have access to good information, and for all of us members of the public to educate ourselves.
That's our time for now. Join us this week on KRWG Radio every weekday. It's Morning Edition 5 to 9, Fresh Air at 11, followed by Here and Now, noon to 2, and All Things Considered 4 to 7. KRWG News is always online at krwg.org, and we'd love to hear from you. Email us with story ideas and video submissions. The address is feedback@nmsu.edu. For all of us at KRWG News, I'm Madison Staten, in for Fred Martino. Have a great week, everyone. We'll see you next time on Newsmakers.